Hello and welcome to the Malaria Notebook with me, Liliana Dayo. Today we are going to learn about malaria surveillance, monitoring and evaluation in Africa. Welcome. So why surveillance, monitoring and evaluation matter is because surveillance guides us on when and where to act. Monitoring checks on whether whatever we are doing is what we planned earlier, whereas evaluation answers the question whether the interventions are working. Highest malaria burden countries require strong data systems for decision making. Good data will lead to smart decisions, whereas poor data will lead us to making wrong decisions, sometimes leading to missed outbreaks and also wasted resources. So what is malaria surveillance? This is about continuous collection of malaria data, analysis, and interpretation. Malaria surveillance provides timely data that guides action and saves lives. There are different types of malaria surveillance in Africa. We have the passive surveillance, where routine reporting of malaria cases from health facilities is used. For instance, we could have the IDSR, which is the Infection, Disease, and Surveillance Response System, or the DHIS, which is very common in most of the African countries, which is District Health Information Software, a platform for collecting, analyzing, and interpreting data. We can also have active surveillance, where health teams actively search for malaria cases through outreach, surveys like the Kenya Malaria Indicator Survey, or household visits. We also can have sentinel surveillance, where intensive data collection from selected sites is used to make decisions on whether, for instance, we could be having drug resistance of some of the malaria commodities. We also can have the case-based surveillance, which is common in elimination settings, and every malaria case is reported, investigated, and responded to as soon as possible. Sources of malaria data include health facilities, registers, community health workers or promoters registers, laboratory registers, the DHIS2, and national surveys, amongst others. So what is monitoring? Monitoring is the routine tracking of activities and outputs. It focuses mostly on implementation of activities. It uses indicators to measure progress. Some of the common monitoring indicators include, for instance, for malaria testing rates, we could look at the proportion of suspected malaria cases tested. On IPTP SP uptake, we could look at the proportion of pregnant women on the first IPTP. On ITN coverage, we could monitor the proportion of households with at least one ITN. And for commodity stock levels, we can decide to monitor the months of stock of the various malaria commodities. How about evaluation? This is a periodic assessment of effectiveness. It measures impact of outcomes. It supports accountability. We have different types of evaluation. We have that which is done at midterm, which checks the progress of implementation midway, and it's normally used to guide improvement. We could have the endline evaluation, which assesses achievement of targets at program completion. We could also have the impact evaluation, which measures long-term changes caused by the various interventions employed. How do we link surveillance, monitoring, and evaluation? Surveillance is about what is happening with malaria. It tracks cases, trends, hotspots, and outbreaks. In monitoring, we check whether what we are doing is what we plan to do. It follows implementation, coverage, quality, and timeliness of activities. In evaluation, we check whether our actions made a difference. It assesses results, outcomes, and impact on malaria burden. So the table on the screen compares different surveillance and monitoring and evaluation in different African countries. For instance, in Kenya, the main surveillance system is the KHIS2, previously referred to as the DHIS2. We also have the IDSR. At the community levels, we have the CHPs reporting either on paper, but there's a lot of advocacy to transit onto digital platforms. We also have the electronic logistic management information system. And generally, we have a strong community facility linkage with regards to data management. In Nigeria, similarly, the DHIS2, the community structures use the mobile apps and SMS for data reporting. And also they have the electronic logistic management information system for their commodity management. Generally, they have a mixed digital maturity with regards to data management. Countries such as DRC, Mozambique, Uganda, all have got different surveillance systems, both at the health facility, community, and also a separate system for commodity management. So the picture on the screen is a demonstration on how the World Malaria Report use surveillance data to report on the malaria cases that are available currently. And we can see from the report of 2025 that in 2024, there were about 282 million malaria cases that were present. The country with the highest malaria burden was Nigeria, and Nepal, Eswatini were among the countries with the lowest malaria burden. So on knowledge assessment, based on available surveillance data, what is the current situation of malaria at wherever place you are? To what extent are malaria activities implemented as intended? And what evidence shows that malaria interventions are reducing cases or deaths? Lastly, how can malaria data be used to improve actions at the community level? The key take-home message for today is that strong data systems are critical for malaria control. Also important to note that Africa is improving steadily with regards to surveillance capacity, and data must always be used for decision-making at whatever level. Thank you for listening. Let's subscribe for more lessons from the Malaria Notebook. Let's fight malaria one lesson at a time.